Hi, I am Saja Brito and you're welcome to News Review. Coming up this hour today, mass testing in Bakau amid COVID-19 cases, and APRC PRO says coronavirus is real but doubts if Gambia has any cases so far. May 3rd is World Press Freedom Day, a day to celebrate the fundamental principles of press freedom around the world. I'll be joined later on the show by the Vice President of the Gambia Press Union, Mustafa Dabo, to talk about why this day matters, and of course an overall look at the Gambia media industry. But first, let's take a look at the newspapers. The Standard newspaper is reporting that Modutro Dabo VDF to give out 130,000 bags of sugar and rice, and the GDC's MC Cham tells Independent Electoral Commission to deregister NRP and other political parties, and the GMC executive member joins President Barrow's NPP. Let's take a look at some of these stories in detail. Modutro Dabo's VDF to give out 130,000 bags of sugar and rice as a charity. One of the Gambia's leading philanthropists, Modutro Dabo, will give out a reported 130,000 bags of rice and sugar to the people in the Gambia in this month of Ramadan. Beneficiaries will include needy people, members of the armed and security services, and regional and municipal authorities. Mr. Dabo, a businessman, has been holding this massive Ramadan giveaway for many years through his NGO, Vision Development Foundation. According to sources close to the foundation, the hardships brought about by the coronavirus restrictions necessitated the upscaling of the giveaways this year. GDC's MC Cham tells Independent Electoral Commission to deregister NRP and other political parties. The youth leader of the Gambia Democratic Congress has called on the Independent Electoral Commission to deregister some political parties before the next round of election begin. Mr. Cham Jr. told the Standard newspaper that the IEC needs to go back to the drawing board and critically look at the electoral laws to strike out organizations that have not fulfilled requirements to exist as bona fide political parties. The said activities of the NRP of Minister Ahmad Ba, GPDP of Henry Gomez, and the NPP of President Adama Barrow should be probed because they are structureless, says MC Cham. GMC executive member resigns and joined President Barrow National's People's Party. Mamadou Sidibe, an executive member of the Gambia Moral Congress and a respected prominent member of the Serekunda West community, has resigned from the party to join the National People's Party of President Adama Barrow. Sidibe, who joined the GMC in April 2017, first held the powerful and important position of administrative secretary before becoming an executive member responsible for constitutional matters and discipline at a subsequent party congress. Confirming his resignation to the Standard newspaper, Mr. Sidibe was quoted as saying, "I supported the GMC at the invitation of its leader, Honorable Mai Ahmed Fati, and also because it was part of the coalition. Now that Mr. Fati has left the government effective, implying that they are no longer part of the coalition, I feel I have to leave." Massive COVID-19 test in Bakau amid new confirmed cases of coronavirus. A massive COVID-19 rapid testing has begun in Bakau yesterday as the number of new cases in the country increased rapidly. Dozens of frontline health workers accompanied by security personnel were in the town to voluntarily screen and test residents who may have come in contact with the new confirmed cases for symptoms of COVID-19. The development comes as the number of infected cases continue to grow with 5 new cases. Health officials told the Standard newspaper that the samples collected from over 1,000 community volunteers are expected to be sent to the Medical Research Council for verification, and those with confirmed or highly suspicious cases will be contacted. Food items worth $1 million distributed to needy Gambians. Food items worth over $1 million have been distributed on Friday to needy Gambians across the country by a Qatari philanthropist. The aim of the donation is to alleviate hardships that needy families are going through as a result of the COVID-19 pandemic. That's it for the Standard newspaper. Let's take a look at the Point. Similar stories on the Point, of course. Bakau embarks on mass testing amid COVID-19 cases. Commonwealth chief testifies in Yankuba Toure's trial, and Gambia registers 5 new cases of COVID-19. Let's take a look at that story. The acting director of health services, Dr. Mustafa Betey, on Saturday in a press briefing confirmed that the country has registered 5 new cases of COVID-19, making a total of 17. He stated that Saturday's confirmation was one of the highest number of confirmed cases in a single day. He added that among the cases, one was reported from Central River region, which is the first confirmed case from the region. He said one is linked with the case number 12 and 3 were close contacts of the 11th case. That's it for the newspapers. Let's have a break and then we'll be right back. Welcome back. And now the Ministry of Health has embarked on a massive sample testing in Bakau following confirmation of 5 new COVID-19 cases. This will be the highest number of confirmed cases in a single day. Fatou Kamara Jr. was at the Bakau Community Center and she now tells us more.
The turnout was massive. Men, women, young and old, all out to find out if they had the disease.
But actually, yesterday the team I went with, I did not face such things. Because as a councillor, people have the respect for me. And I'm also very much concerned about the health of my people. Definitely. So when they saw me, they impressed us. And then we had a nice chat with them. And then I told them this is what happened. And there's a case discovered in Bakau. So we want to minimize it, even though we cannot stop it. But we don't want that to go further. Let's try to stop at that single case. But on my surprise yesterday, I received a text message from the Lord Mayor. They, on our KMT, WhatsApp group. I saw another 5 cases discovered. But these 5 cases, I think it's only 2 cases positive in Bakau. That means that the number is increasing.
This gentleman was among those that came out to take the test.
ngane fa kamindi abumobe ngane fenel melonko akatrebulu londo nyabe wala nyama nin do torolo ko ala ngane wala ko ala nyinke itami mano ima keno ake niko sidula killing niko nyinke ake ndewol bente bulu ha ndin do toro min fo mbuka soso ala londo diala purukake.
The coronavirus pandemic has caused a lot of anxiety in Bakau after 2 people tested positive from the town. This has now prompted the Ministry of Health to act fast.
It's not actually easy, and especially in this pandemic period. Other countries that are more powerful than Gambia are suffering. So we cannot say we are not faced with challenges. And then, thank God we, as healthcare providers and as frontliners, especially at the lab, we are able to respond. And then, as you can see, this is a team that is involved in the collection of samples. And then, currently we are on the verge, most likely early next week, or after that, possibly before the end of the week, we will start maybe testing at our own level. So, and then it will be easier, and then to both for sample collection and then for sample testing. And as we are, our collaboration with MRC is working well. So I think we will not be overwhelmed with both testing and sample collection. So yeah, the government is doing everything to make sure we are able to control the COVID-19. And then, but it is important for people to realize that this is a simple process and a process that is not invasive. And then let people come up and then volunteer.
The number of coronavirus cases in the Gambia stands at 17 following the confirmation of 5 new cases over the weekend. It was the biggest number of cases confirmed in a single day in the country. Fatou Camara reporting for the Fatou Network News Review.
TAF Africa Global is proud to launch the Moria Gardens, conveniently located in Bruford, 5 minutes off the Bruford Highway. Moria Gardens is set to comprise of 20 fenced and gated service plots with sizes ranging from 264 to 420 meters square. Unique features include water and electricity infrastructure, solar street lights, all-weather roads and scenic gardens. We offer a 10-year mortgage plan with a 25% equity down payment in partnership with GT Bank, Trust Bank and EcoBank. For more information, please contact 376-2333 or 776-2333 or visit our offices at Madiba Mall at Taft Bruford Gardens, opposite 5-Star Hotel.
Welcome back. And now the coronavirus pandemic has been accompanied by an outbreak of fake news, conspiracy theories and false claims. Whilst government puts up a fight in containing the deadly virus, APRC's PRO has his own theories. Let's take a look.
Coronavirus shook the whole world without doubt. I don't think anybody in their sane mind would deny that coronavirus exists. Like they say, seeing is believing. We've seen videos, heard audios, pictures, so nobody can doubt what's happening across the world, China, America, Italy, Spain, the UK, France, and the like. So whoever does not believe that it exists, I believe something is wrong with you, definitely.
In the case of the Gambia?
Yes.
What do you think?
In the case of the Gambia, I only saw one case. The first case, the sister traveled from the UK to the Gambia. They showed us pictures, drips or pipes being fixed in her so that she'll be able to have oxygen. And it's the same thing we see in other countries. But besides that, everything else is just verbal and it's theory. We're not seeing any practical. They're not giving us any proof. So I don't think we have corona in this country.
That's a very, very wild and serious claim. Why would they risk it just telling people that we have coronavirus in the Gambia when we don't have it? That's a very serious allegation, dude.
No, it could be an allegation, but I stand by my word, and everywhere I can defend myself. Making comparisons to other countries, they're taking it seriously. Not total lockdown, but especially social distancing. They took strict measures to make sure that people are keep apart. Come to the Gambia, it's not happening actually. You go out in the streets, everybody is mingling, we're socializing, interacting, shaking hands, all the things that the state of emergency told people to restrict them from, allowing a number of 10 people in ceremonies, be it funeral, naming or marriage. It's not happening anymore. And the government is seeing that. Seriously,
but do we blame government for that? They have come up with regulations, they have come up with precautions. Even the World Health Organizations came up with precautions and said, we should follow this. Should we blame government for that? It could be just the typical Gambian attitude saying, okay, I do not care.
Government should care for its citizens. Yes, we have to blame them. If it's always to their interest, they will enforce. But when it comes to, at times, compromising, health is life, health is wealth. When you're not healthy, definitely it's tantamount to loss of life, because many things you won't be able to engage or embark on them. And if you have concern so much for your citizens, you will put every measure to see that you will contain this coronavirus. If you don't contain it, you allow people to do as they please, how would we prevent this coronavirus? So seriously, I don't think there's corona in this country.
But we already have one death. Do you think that Bangladeshi man died of coronavirus?
I would be naive to say yes. Based on the signs and symptoms and the way this COVID-19 is spread, in senses of shaking hands, when people sneeze, when you're too close to people, they said you could contain the virus through such. Somebody who traveled from Bangladesh with a group of people through Mali to Senegal to Gambia, how many is that? And they interact with each other. He's mingling with people in the process of preaching. All those people are tested but negative. But the guy was positive and he died of that. Let them show us proof. He was first admitted at the Jame Foundation for Peace Hospital. Any diagnosis to say he was diagnosed of corona? Nobody can tell you. People said he died of pneumonia, having problems with lung finding it difficult to breathe. And what they said when he was attacked, they called ambulance thinking he is affected by corona, and they made him to wear a mask which would restrict the energy and how you'll be able to breathe properly. They said he died before he reached hospital. How did they confirm that he died of corona? Let them show us reports, diagnosis. Seriously, even the patients that were arrested, they said they had this coronavirus, and they said their report and tests were sent to Senegal. They're giving them copy of documents, not original documents, photocopy. I've seen it with my eyes, and I have evidence of that. What are we providing? Seriously, somebody has corona, you claim that they have it, you went and arrested them. They're arguing, I don't have it. Somebody who is sick doesn't need to argue. You don't need to arrest them. With what we're seeing around the world, if you're affected with corona, you will take yourself to the hospital. The people you live with, when they discover the symptom, they will not allow you to stay in that house or compound. They will take you to the hospital. But instead, they're going around looking for people they think are affected and arresting them. Where is that happening in the whole world? Name me one country where they're going around arresting people and said they have corona. Only in the Gambia.
But the big question is, why do you think anyone would do that? Some people think that it is because of the funds, the money. What do you think?
Exactly. That's my take as well. With the amount of money being pumped in every country, those that
Who
are
would
affected.
play around something as serious as this in the name of funds?
Gambia, I would say. Because look at the health minister, Mr. Samate. You come and give people update. You telling us numbers, those that are positive, negative, tested, and the like. Show us. Seeing is believing. Where are the patients? You don't need to show their faces. You don't need to identify them, name, address, where they live. No. People want to see these patients that are sick. End quote.